Namaste. Myself, Dr. Dayananda. I'm a senior cancer Ayurveda consultant and research coordinator in Sriranga Ayurveda, Mysore. In this Sriranga Ayurveda channel, we would like to discuss more on cancer.
Start.
Whenever we come across with a patient, especially the cancer related, the first question comes up, why me? Why not others? They were also doing something, or their lifestyle was so bad. Why me? So it's quite difficult to say the answer for that. But there is no one cause for the cancer. It's a multiple causes which come together to form the cancer. Sometimes it is triggered during our birth itself, or sometimes we get it through our lifestyle. Lifestyle includes food, activity, behavior. I'm emphasizing on those things because that is the cause, that is the health. Whenever you're seeing that, what is the best? What we do is only these things. But these things are there. How do you adopt them on your prakriti? What is your prakriti? That has to be first decided. For that, you may not be able to go with the online things, which we can see there. Multiple choice will be given where you choose, and then outcome is like mathematical. That is not sufficient. Some Ayurveda physician has to be having an intervention to see and assess whether whatever you're filled up is right or wrong. Because most of the time we try to present ourselves as best as we are. And sometimes we cover up with a shield saying that I am the best, but it may not be, or you might be. So in that case, somebody has to see you, identify your prakriti. So the consultations are required to know that. On that basis, once again, your food habits, your daily activity and behavior advice has to be given. If you're looking at all those things, that means ultimately what we see is whatever is given to you as a best has to support you. Most of the time what we see is we try to put ourselves in the scale of standard which is best for others. That doesn't work. So as Ayurveda believes in individuality, you as an individual person, you need a tailor-made consultations, diet, and activities advised as per your lifestyle. Or nowadays we can see that we are living because of our job. Earlier it used to be the job as a part of our life. So the importance has changed. So as per your occupation, how we can make you fit to do your best whatever you do in your job, and you prevent your health getting deteriorated. That means most of the time when you get retired, then all of the diseases will attack us most of the time. We believe that I was okay when I was working, but that is not the way. Usually you push yourself, or your body was capable to control all those things because your immunity was good, your intention was good, your intuition was good. All of a sudden you feel like relaxed, then everything is relapse or anything is coming down. So to know this, the consultations are required. In Sriranga Ayurveda, we are doing the lifestyle consultations also. Because Ayurveda believes in preventive care. Curative is the secondary aspect. Most of us think that Ayurveda is an alternative science or Ayurveda is a medical science. No, it is a preventive science. When the prevention doesn't happen, that means if you're not following your lifestyle, that is food habit and behavior which are good for you, or if you're following something good what is being advised by the most of the people, believing that that is the best, then you go wrong. So here the consultations are required, which is mandatory to see the doctor personally and take the advice on these things, because these things keep on changing. It's not like once you have the diet list and you follow that. That has to be modified or altered as for the seasons, as for the age. So it is a continuous journey which you're starting with Ayurveda to keep your health as a fit. Of course, the death is inevitable. There's no doubt. It's for me, for you, everybody's there. But how we live, how was the journey, that is very important for us. Death will happen just like in birth. Somebody is sleeping and next day morning is not there. That's so beautiful. or a blissful death. If you go through the journey of suffering, then you know, or you ask for yourself saying that, why can't we have a mercy killing, or why does God doesn't take us away? So rather than that, everything has to be fit means you keep investing on your health, as periodically we say that through panchakarmas at different stages of ages, or as per your diseases, as per your stress factor which is happening in your life, or the food habits which are exposed to carcinogenic, or any diseases can happen. So here, proper detoxifying and then followed with the lifestyle is a secret of keeping you away from multiple diseases as well as a deadly diseases like cancer. So Sriranga Ayurvedic Chikitsa Mandira is equipped, or well equipped, I can say that, to identify, to advise preventive as well as curative aspects of Ayurveda. We have multiple specialty of consultations, which each one is emphasizing on each diseases or each system, where one is well versed with the things which they can identify initially, whatever the prognosis happening later on, so that we can prevent the prognosis that itself the disease is getting arrested, or we can treat with precise accuracy with minimum medications and minimum panchakarma procedures, which helps to get recovery as early as possible. So opt us to get the better health as early as possible. Thank you.
ನಮಸ್ತೆ. ಹೇಳಿ ಮೇಡಮ್, ನೀವು ಎಲ್ಲಿಂದ ಬಂದಿದ್ದು?
ನಾನು ಮೈಸೂರಿ ರಾಜವಿನಗರ
ರಾಜನಗರದಿಂದ ಬಂದಿದ್ದು.
ನಮ್ಮ ಯಜಮಾನರು ಕೂಲಿ, ನಾನು ಕೂಲಿ. ನಾವು ಮಾಡೋರೇ ಗತಿನಿಲ್ಲ ಭಗವಂತ.
ಏನು ತೊಂದರೆ ಇತ್ತು ನಿಮಗೆ?
ನನಗೆ ಅನ್ನ ಹೋಯ್ತು, ಸುಸ್ತು, ವಾಮಿಟ್. ಇಲ್ಲಿ ಕೂತ್ಕೊಳ್ಳೋಕೆ ಆಯ್ತದೆ. ನಾನು ಊಟನೇ ಸೇರಕ್ಕೆ 2 ತಿಂಗಳು ಹೊಟ್ಟೆ ಊಟನೇ ಹೋಯ್ತಾ ಇರಲಿಲ್ಲ. ಆಗ ಯಾರೇ ಇಲ್ಲಿ ಹೋಗಿ ಮೆಡಿಸಿನ್ ಆಗ ದೊಡ್ಡ ಆಸ್ಪತ್ರೆಯಲ್ಲಿ ಅಲ್ಲೆಲ್ಲ ಸೈನ್ ಮಾಡಿ ನಮ್ಮ ರೇಷನ್ ಕಾರ್ಡಿಂದ 6 ಇಂಜೆಕ್ಷನ್ ಅದಾಯ್ತಾ. ಅದು ಫಸ್ಟ್ನೇ ಇಂಜೆಲ್ಗೆ ಸ್ವಲ್ಪ ನಂಗೆ ವರ್ಷ ಒಂದು ಇಂಜೆಕ್ಷನ್ ಕೊಟ್ಟರಲ್ಲ ಫಸ್ಟ್ನೇ ಇಂಜೆಲ್ಗೆ, ಆಗ ಸ್ವಲ್ಪ ವರ್ಷ ತಿರ್ಗಾ 4ನೇ ಇಂಜೆಕ್ಷನ್, ಆಮೇಲೆ ಕರೆಕ್ಟ್ ಕೊಡಿ 3ನೇ ಇಂಜೆಕ್ಷನ್.
ಇಲ್ಲಿಗೆ ಯಾರು ನೀವು ಕಳಿಸಿದ್ದು?
ಸೈಯದ್ ಡಾಕ್ಟರ್ ಇಲ್ಲಿ ಸಂಜೀವಿ ಕ್ಲಿನಿಕ್ ಬಂತಾರೆ. ಅವರು ಮೊದಲು ಒಬ್ಬರು ವಾಸಿ ಆಯಿತು. ನೀನು ಇಲ್ಲಿಗೆ ಹೋಗಿ ನಮ್ಮ ದಯಾನಂದ ಡಾಕ್ಟ್ರು ನಮ್ಮ ಅವ್ರ ತಂಪು ಹೋಗಿ ನಿಮ್ಮ ಕೊಡ್ತಾರೆ ರಜೆ ನಾನು ಹೇಳ್ತೀನಿ. ಇವರು ಫಸ್ಟು ಒಂದು ಆ ಕಾಲು ಊಟ ನುಂಗ ಕೊಟ್ಟರು, ಮಧ್ಯಾಹ್ನ ನುಂಗ ಕೊಟ್ಟಿದ್ರು, ರಾತ್ರಿಗೂ ಮನೆ ಕಳೆದು ಕೊಟ್ಟಿದ್ರು ಮಾತ್ರೆ. ಫಸ್ಟ್ ಒಂದು 6 ತಿಂಗಳು ಚೆನ್ನಾಗಿ ತಗೊಂಡೆ. ಆಮೇಲೆ ಕಡಿಮೆ ಮಾಡಿ 6 ತಿಂಗಳು ಚೆನ್ನಾಗಿ ಮಾತ್ರೆ ಎಲ್ಲ ತಗೊಂಡ. ಆಮೇಲೆ ಒಂದೊಂದು ಟೈಮ್ ತಗೊಂಡ, 2 ಟೈಮ್ ಮಾಡಿದ್ರು. ಆಮೇಲೆ 1 ಟೈಮ್ ತಿರ್ಗಾ ಈಗ ಮಾತ್ರೆ ಏನು ಬೇಡ, ಏನಾರ ನೋವು ಬಂದರೆ ಪುಷ್ಟಿ ಮಾತ್ರೆ ತಗೊಂಡು ಈಗ ನಾವು ತಗೊಂಡು
ರಿಪೋರ್ಟ್ಸ್ ಮಾಡಿದ್ರೆ
ರಿಪೋರ್ಟ್ಸ್ ಎಲ್ಲ ಯಾವ ಎಲ್ಲ ಕ್ಯಾನಿಂಗ್ ರಿಪೋರ್ಟ್ ಇವ್ರ ಕೈ ಬಂದ ಅದೇ ಇರ್ತಾವೆ.
ಓಕೆ, ಸೊ ಸ್ಕ್ಯಾನಿಂಗ್ ರಿಪೋರ್ಟ್ ಅಲ್ಲೆಲ್ಲ ನಾರ್ಮಲ್ ಬಂದಿದೆ
ಎಲ್ಲ. ಈಗ ವಾದ ವರ್ಷ ಇವರು 8 ತಿಂಗಳೇನು 6 ತಿಂಗಳಾಗದೆ ಅದನ್ನ
ಎಲ್ಲ ನಾರ್ಮಲ್
ಬಂದಿದ್ದಾರೆ.
ಎಲ್ಲ ಈ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಳಕ್ ಶುರು ಮಾಡಿದ್ರಿಂದ ನಾರ್ಮಲ್ ಬಂದಿದೆ. ಸೊ ಇವಾಗೆಲ್ಲ ಊಟದ್ದು ಹೇಗಿದೆ ನಿಮ್ಗೆ? ಇವಾಗ ತೊಂದರೆಗಳು ಏನಾದ್ರು ಇದೆಯಾ?
ಏನಿಲ್ಲ.
ನಿಮ್ಗೆ ಇಲ್ಲಿ ಟ್ರೀಟ್ಮೆಂಟ್ ಹೇಗೆ ಅನಿಸ್ತು? ಈಗ ದಯಾನಂದ ಡಾಕ್ಟರ್
ಇಲ್ಲ, ಸರಿ ಆಯ್ತು,
ತುಂಬಾ ಚೆನ್ನಾಗಿ,
ತುಂಬಾ ನಂಗೆ ಕ್ಲಿಯರ್ ಆಯ್ತು. ಊಟಕ್ಕೆ ಸರಿ ಆಯ್ತು, ಏನ್ ಊಟ ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ.
ಇವಾಗೆಲ್ಲ ಊಟ ತಿಂಡಿ ಎಲ್ಲ ತುಂಬಾ ಚೆನ್ನಾಗಿ ಹೋಗುತ್ತಾ?
ತೊಂದರೆ ಇಲ್ಲ. ನಾನೇ ಫುಲ್ ದಪ್ಪ ಹೋಗ್ತೀನಿ ಅಂತ ಆರೋಗ್ಯಕ್ಕೆ ಎಷ್ಟು ಬೇಕು ಅಷ್ಟು ತಿಂತೀನಿ. ಊಟ ತಿಂಡಿಗೆ ಹಸು ಆಗುತ್ತೆ ಅಷ್ಟೇ. ನಮ್ಮ ಜೀವನ ಈಗ ಏನಿಲ್ಲ. ಇವ್ರು ತಮ್ಮ ತೋರಿದ್ಮೇಲೆ ಒಳ್ಳೇದಾಯ್ತು. ಸದ್ಯದಲ್ಲಿ ಅವ್ರಿಗೆ ಕೈ ಮುಗಿಬೇಕು. ನನಗೆ ಅನ್ನ ಋಣ ನನಗೆ ಇಲ್ಲಿಂದ ಇಲ್ಲಿಗೆ ತೆಗಿಬೇಕು ಅಂದ್ಬಿಟ್ಟಿದ್ರು ತಿರ್ಗಾ. ಆಮೇಲೆ ನಮ್ಮ ಸೇವೆ ಡಾಕ್ಟರ್ಗಳೇ ಕರೆಗತ್ಲಿ ನಮ್ಗೆ ಈ ಡಾಕ್ಟರ್ ಎಲ್ಲ ಕ್ಲಿಯರ್. ನನಗೇನಾಗೋಯ್ತು, ಇವ್ರು ವಾಮಿಟ್ ಆಗಂಬಿಟ್ರೆ ನಾವು ಒಂಥರ ರೋಡ್ ಸರ ಥರ ಬಿಸಿ ತಿಂದ್ಬಿಟ್ರೆ ವಾಮಿಟ್ ಆಗೋದು. ನಮ್ಮ ಮಕ್ಕಳೆಲ್ಲ ಎದುರ್ಕೊಳ್ಳೋರು, ಏನಾಗಿ ಸರಾಗೈತೆ ಏನೋ ವಾಮಿಟ್ ಸುಮ್ಮನಿಗೆ ತಿರ್ಗಿ ಏನಿರ್ಬೇಕಂತ ತಿನ್ಕೊಳ್ಳೋದು. ಸರಿ ಆಗೋದು ಹಂಗೆ. ಇನ್ನು ನನ್ನಂತವ್ರು ಇನ್ನೂ ಒಬ್ರು ಒಳ್ಳೆಯದಾಗಿ ಬದುಕ್ತೀವಿ ಚೆನ್ನಾಗಿ.